bone cancer or bone sarcoma. It is a rare disease which appears in the long bones of the upper arm and thigh, hip bone, vertebral column and shoulder area. Usually it appears in children, early age, that is under 30 years, youngsters, they are main sufferers of this cancer. This cancer is classified into osteogenic sarcoma, which originate from the cells of the bone, osteoblast, osteoclast. These are two types of cells of the bones, and it is also called as osteogenic sarcoma. It usually appears in the early childhood and teenagers, whereas other ones, they are lesser in ratio. That is called as chondrosarcoma. It is a chondrogenic one, that it originates from the connective tissue surrounding the bone cells. And other one is Ewing or the Ewing sarcoma. So these are main three types of sarcoma of the bone. Whereas the chondrosarcoma, that mostly appears after the age of 30, that is we can call as in the old adults. So these are the basic, the classification of the bone sarcoma. Now it is further classified into primary and secondary one. Primary means that originate it from the within the bone, whether it is a osteogenic or chondrosarcoma. The native or the starting point is within the bones, especially the long bones of the thigh and upper arm. Whereas the secondary is, that is from the distant organs, from the lung cancer, from prostate cancer, breast cancer, kidney cancers, the metastases travel via bloodstream and they reside in the bones and they produce their cancerous lesion within the bones. This type of sarcoma or cancer is called as secondary one because originally they belong to some other organs. So primary one is the sarcoma or the cancer of the bone that originally originate within the bone matrix. Now there are various grades of the sarcoma. In grade 1, the cancer cells are limited in a short area within the bone. In grade 2, these cells, cancerous cells, become aggressive and start replication rapidly and spread throughout the bone area or the bone matrix. This is the stage 2 one. While the 3rd stage, which is called as metastatic stage, is when the cancer cells enter the bloodstream and float through the blood flow to the distant organs of the body, that is breast, brain, kidney, prostate. So these cells, they start growing in that target organs and they produces the secondary cancer in that distant organs. So this is called as metastatic stage, and it is a very advanced, critical and devastating stage of the cancer. Now the etiology of the bone cancer. Like other cancers, still there is no evident or clear etiological factors known to the knowledge of the human being, but these etiological factors are divided into intrinsic factor and extrinsic factor. We call it extrinsic and environmental ones. The factors outside the body that act as risk factor and or aggravating factors or causative factors. So there is family history, that is the inherited familial predisposition of this bone cancer. There are particular genes, they are transmitted from the parents into the offsprings. So these abnormal genes, they are responsible for the creation of the bone cancer in the patients. Other factors, that is frequent exposure to the radiotherapy, prolonged use of chemotherapy due to other pathologies or disease in the body, extra to the bone system, musculoskeletal system. And the other factor is the physical stress, trauma, fractures, accidents, due to accidents, and physical violence over the bones, especially the long bones of the thigh, upper arm, hips bone, vertebral column and spines, and the shoulder area. So these are the most commonly sites of bone cancer in human body. So the actual pathogenesis is, that is conversion of the normal DNA of the bone cells into the abnormal DNA. That is called the cancerous DNA. Because the abnormal DNA or cancer DNA is unable to control the lifespan and the speed and the limit of the division of the normal cells. So the overactivity or the overproduction and replication, there is humorous or the countless production of the cancer cells. And these cancer cells, they cut off the blood supply of the and nutrition to the normal bone cells or cells of normal organ of anywhere in the body. So they suffer ischemia and subsequently die away, and there is fibrosis, that is death of that organs. So the function of that organ, particular organ where the cancer is invading, become functionless and may cause the fatal condition, that is the death of the patient. So similarly in the bones, the normal cells of the bones, normal connective tissues, and the cells of the bone, that is osteoblasts, osteoclasts, they die away due to the action of the cancer cells, abnormal cells, due to overproduction of the abnormal cells or cancer cells within the bone mass. The sarcoma is produced in the connective tissue of the bones, whereas the osteogenic sarcoma is produced from the bone cells. That is called, it is osteogenic sarcoma, that is osteoblasts and osteoclasts.